Hello, everyone. Welcome to Hey Siri, the late night talk show for all your cultural knowledge. As always, I'm your host, Siri Harish. Now, as many of you guys know, I love to talk. And what do we talk with? We talk with our mouths. So, today we're going to talk about oral health, and our special guest is Dr. Rekha Patil. So, thank you so much for joining us today. And for our audience who doesn't know you as well as I do, would you please introduce yourself, your education, and what you do currently?
Okay. Hi, Siri. Thank you for having me on your channel. I'm excited to be here. I'm Dr. Rekha Patil, board certified pediatric dentist. My practice is located in Perth Amboy, New Jersey. As far as my education goes, I completed my BDS degree in India and my DDS degree from University of Southern California, Los Angeles. I practiced for a year in private practice setting and where I saw mainly kids, and I enjoyed that field. So I decided to pursue my career in pediatric dentistry. And then this is a very age-specific specialty where we treat infants, children, and adolescents. We also provide care for developmentally disabled patients, and we offer all types of services like sedation dentistry and hospital dentistry. So you get this well-rounded training in this postdoctoral training programs, which I completed in 2008 from Jacobi Medical Center, Bronx, New York. And I've been in private practice ever since. It's been more than a decade now.
Okay, so our first question is: does oral health have more to do than just taking care of your teeth?
Yes, that's a great question, Siri. And the answer is yes. Health of the mouth mirrors the health of the body. It offers clues about your overall health. That means disease in the other parts of the body often causes symptoms in the oral cavity. Right? For example, diabetics. Right? Diabetic patients are prone to get periodontal disease, which is a gum disease that is caused by bacteria in the mouth. In these patients, the blood sugar level is very high, which weakens the person's immune system, that is a defense mechanism. Generally, a simple example or analogy that I can mention: what happens when you throw some sugar bugs, right? So similarly, diabetics, the blood sugar level is very high, which makes them prone to get bacterial and fungal infection. And you also see oral ulcers in the mouth. And the other example I can think of is poor oral health is linked to the heart diseases. So when you think of it, right, our oral cavity is a perfect place for bacteria. It is warm, it is moist, and has steady food supply. So oral bacteria passes through the gum tissue, and if they settle in the lining of the heart or the heart valves, it can cause infective endocarditis. There's another condition called NAC, which is acute necrotizing ulcerative gingivitis. This is caused by the overgrowth of bacteria that normally exists harmless in the mouth, right? Poor oral hygiene along with poor diet, physical and emotional stress, and lack of sleep can cause NAC. There are a few other conditions like GERD, gastroesophageal reflux disease, and eating disorders are some of the other conditions where you will see oral manifestation of the systemic disease. So you see the connection, right, between the oral health and the general overall health. The thing with this poor oral health is it's almost always a very slow process. It can take years of bad oral health to result in severe systemic health problem. So this is often ignored and it just goes unnoticed until long after the damage is done.
All right, so our next question is a little bit especially geared towards adolescents because I know that I guess now smoking isn't as big as vaping is, especially with the introduction of like flavored vapes. So I was wondering if you could talk a bit more about the effects of smoking and vaping on your oral health.
Mm-hmm. Yes, that's a very important topic and that needs to be addressed today. So, e-cigarettes, right? It's also known as electronic nicotine delivery system. It's a handheld device that produces an aerosol from a solution typically containing nicotine, right? So the act of using an e-cigarette is called vaping due to the vapors that are inhaled and exhaled. And these e-cigarettes are getting a lot of popularity in high school and middle school children. In fact, one of the reports released by CDC in 2019 said 27% of high school kids and 10% of the middle school students have tried e-cigarettes because of the peer pressure and social status and being perceived as cool. In adults, e-cigarettes are gaining popularity because of the indoor smoking restrictions, and it's been marketed as less harmful alternative for tobacco smokers to consume nicotine, right? They have been also used as an aid to stop smoking tobacco and its products. But this claim is not clearly supported by scientific evidence. And as you said, the makers are making it more appealing by selling them in different flavors like chocolate, fruit candy, Belgium waffles, and there are a few more, I think, right? So the thing with e-cigarettes is the base solution that contains propylene glycol, which can cause eye irritation, throat and airway irritation too. And the long-term use can lead to asthma in children, right? Recently, there was a study and that states that there's a national outbreak of lung-associated injuries and death because of the e-cigarette use and vaping. So in general, I would say tobacco in any forms, like smoked, smokeless, or chewing tobacco, can increase the risk of oral cancer, lung cancer, and heart diseases. And in terms of oral cavity, you can get a lot of cavities because of that, dry mouth, gingival recession, and you can also see something called a smoker's palate. So smoking is very injurious, not recommended.
All right, so for our next question, actually has to do with teeth whitening products. So I'm sure you've seen those videos that are viral on TikTok, YouTube, Facebook. So there's also do-it-yourself DIY teeth whitening hacks, like putting toothpaste in aluminum foil and wrapping those around your teeth, or even using banana peels. So I was wondering if you could talk a bit about those. Do they work? Are they harmful?
Yeah, so tooth whitening works, right? There are two types. One is done by a professional, that's in-office tooth whitening, and the other one is the over-the-counter products like the gel or the strips or even the toothpaste. The advantage with this over-the-counter products is it's inexpensive and it's convenient to use. And in case of in-office bleaching, this is very effective because as the concentration of the bleaching agent that they use is much stronger and it works faster and quicker too. But the thing with this is it's not going to bleach any bleaching agents, right? It's not going to bleach your silver fillings or the crowns or the veneers that you use. Now, as far as those do-it-yourself teeth whitening hacks are concerned, I would stay away from that because I think the aluminum foil, right, it can cause pain and sensitivity of the teeth, and also the abrasive agents, that's the baking soda and the salt. It can cause erosion of the enamel, so it's not recommended.
All right, so for our last question for today, we actually would like to know what are the different ways we can take care of our oral health?
Okay, so the two most common dental diseases are caries and gum disease. They say caries is 5 times more common than asthma, followed by asthma and obesity. Generally in pediatric dental offices or any dental practices, we use a tool called caries risk assessment. So based on our clinical findings and information gathered after interacting with the parent about the patient's oral hygiene and diet, we classify patients as high caries risk, moderate, and low caries risk. Based on this classification, we offer them dietary recommendation, right? So, but in general, to maintain good oral health, it starts with your regular dental visit, seeing a dentist, right? This plays such a critical role because dentists diagnose the problem in its initial stages and treat it, right? And in order to maintain a good oral health, you have to brush your teeth twice, every morning and every night. And in the mornings, you can either do it before the breakfast or after the breakfast. It's the personal preference. I would prefer to do it before the breakfast. So use a good quality fluoride toothpaste, and make sure you're brushing each and every surface of the tooth, right? And then flossing is also very important, because by flossing, you're actually cleaning in between the teeth, in between the teeth where the bristles of the toothbrush doesn't reach. So when you're brushing your teeth, you're basically cleaning all the plaque of the teeth, which harbors bacteria. And also, using a mouthwash is highly recommended, as it keeps the bacterial count low. And in terms of the diet, I always stress my parents to consume healthy diet, stay away from food that's rich in sugar. And teenagers love to have juice, soda, fruit drinks, sports drinks, which are loaded with sugar. So avoid it. Whenever you're hungry, go for a healthy snack. And when you're thirsty, grab a bottle of water, right? So our model, Ria, will demonstrate proper brushing and flossing technique.
So I'm going to be showing you how to thoroughly and completely brush your teeth. And you can either use a manual or an electric brush, but when you're brushing with a manual, it's very important to hold it at a 45-degree angle, and you're going to want to brush in a circular motion. And then you're also going to want to brush in the back the same way, and also want to get like the front part of the teeth, and you're going to want to do that for the front teeth, and brush in a circular motion. And these 4 front teeth, you're going to want to brush them in a circular motion also, but in the back, you're going to want to go in a vertical motion. And then you do the same for the last 3 front teeth, where you brush in the circular motion, and then the back, you're going to want to go up and down again. And then you would do the same for the front teeth here. So you'd want to brush in a circular motion, and then in the back, and also in a circular motion, and also get like the front view of the teeth. So you're brushing there. And then for the 4 front teeth, you're going to want to go in a circular motion for each of the teeth, and then go in a vertical for them again. And then here you're going to want to go circular, and also get it near the gum, so you can because the string, the brushstrokes, you want to get them near the gum to remove any loose plaque. And then you're going to want to go in a circular motion again in the back. And then I'm also going to be showing you how to floss. And you could either use a floss pick or a piece of thread. In my example, I'm going to be using a piece of thread. So you're going to want to go in between like the crevices of your teeth. And again, so you're going to want to go like that to get any remaining residue or dirt out of the teeth. You're going to just go like that for each one of them. And then you just do the same for the front teeth. Yeah, and then you just do the same.
All right, perfect. Thank you so much for showing us the proper brushing and flossing techniques.
Thank you so much.
All right, so that's all the time we have for today. But before we go, would you like to say any last words for our audience?
Yes. I just want to add one more thing for a topic of discussion. Currently, I see this trend where teen kids are going for this intraoral jewelries and intra and perioral piercings. This type of practices comes with certain risks like decay, gum recession, fracture of tooth, pain and infection. In severe cases, it can also cause lingual nerve damage and speech impairment. So it's not recommended. Avoid this, guys, okay? And then we also have heard the saying, you are what you eat. So be mindful of food choices that you make. A healthy diet keeps your body and mind healthy. And in order to have in order to consume healthy diet, you need to have strong, disease-free teeth. Dental disease is preventable disease. So let us all practice in preventing the disease than curing it. And prevention begins with maintaining good oral health, good diet, and make sure you guys visit your dentist for regular checkups.
Okay, so thank you so much for your time. Thank you, Dr. Rekha Patil, and thank you, Ria Shagan, for joining us today on this episode of Hey Siri. And of course, thank you to all our viewers who are tuning in to this episode. Once again, I'm your host, Siri Harish, and we'll see you next time. Bye.